I am Hawkins. I am an occupational therapist, and I have been helping take care of COVID patients on the acute inpatient rehab floor. When the patients first came to the inpatient rehab floor, they were extremely debilitated, had very little endurance and muscular strength, and so we started with the basics. Just working on sitting up on the edge of the bed, because when you're on a ventilator, you're pretty much laying down or you're prone on your stomach. Then we were able to get into standing, and then we were able to work on maybe standing at the sink and shaving, and then we were able to progress to walking to the bathroom. So just taking those little steps, hitting little goals along the way. So kind of just going back to the basics and then going from there was the best way. Anytime we do therapy with somebody, we always want to include their interests or what makes them happy, or what do they want to do, have to do, need to do. So somebody who's 74 and retired, their interests and hobbies are going to be a lot different than the young girl who's in her 20s and 30s who may have a child to take care of or may still be trying to get back to work. So just incorporating those different things, but still overall going towards the same outcome for independence. Our average length of stay for general patients is about 2 weeks, and so we're finding out just a little bit extra time is what they're needing to go home. When they're coming from the ICU, we're finding that their self-care, so their ability to take care of themselves, has been lowered. Their level of independence and even walking and standing is gone completely down, just from the prolonged time on the ventilator and just being in the hospital in general. Our goal with inpatient rehab, just speaking from my point of view, is to get patients as independent and safe as possible. So it's not expected that they'll be back to normal when they go home. A lot of patients are going home with home health care to continue working in their home environment. So it's not expected when they leave the hospital that their journey is done and their therapy is done. It's gonna continue for a while before they get back to what they consider their normal. It's such a feeling of accomplishment, and that, okay, even though this has been so hard, working in a pandemic, our lives have completely changed working in healthcare, but we totally made a difference in his life, and we helped him get back and meet all of his goals that he wanted to do, and it's excitement. Not a lot of tears from us, just more joy.